Ladies and gentlemen, boys and girls, I'm Dr. Larry Burchett, an ER doctor on the front line. And again, I'm joined with Suzy Zinn, who is an adolescent and adult psychotherapist who specializes in eating disorders and trauma. You've got that down. You've done a couple of these. Thanks for showing up and talking again.
Of course, Larry. Thank you for having me.
Suzy, you and I have talked about this stuff before, and as a doctor on the front line myself, I'm really curious to talk to you more about this whole coronavirus thing and how it impacts those of us that are in healthcare, doctors and nurses and paramedics and respiratory therapists. In particular, I'm really curious about your experience as a trauma therapist, and when I hear in New York of doctors feeling overwhelmed and people getting sick and then not being able to help them and kind of, watching and witnessing people dying, I just think about the traumatic impact that could have on providers. And so I thought it would be good for us to just kind of take, the topic of, hey, if you're in healthcare or if you have a family member or friend that's in it and really trying to kind of talk about this from a trauma perspective, both what we can do to kind of prevent that and get through it and that whole thing I thought we could talk about today.
Great. It's such a good topic and it's so important. And I think the community also wants to know how to support people that are on front line and every single day showing up to work and putting their lives at risks for the sake of their communities. So this is such an important topic to discuss. So thank you for asking those questions.
When you kind of hear of the stuff that has gone on in Italy and around the world, does trauma kind of come to your mind? What do you think when you hear about?
Yeah, I think that there's so much healing that's going to need to take place for people, not only the loss, but the isolation, the first time that this has ever happened on a global scale, that we're dealing with we're dealing with coronavirus and dealing with people sort of how to manage something that they don't really understand. And that's all sort of the tricky part of this is the unknown, the uncertainty that day by day things are changing, information is changing day by day. And what we understand about trauma is when there's the unpredictability, there's an event and there's the unpredictability that causes sort of an impact on us emotionally. And so are we going to see lots of people traumatized from what's currently happening, not only from loss, but loss of finances, loss of family members, loss of connections, loss of relationships, loss of identities, loss of kind of how to understand how to move forward. There's so much loss that comes with times like these, and especially unprecedented times like these.
Yeah, loss. It almost gets overwhelming to think about all of the different things and stressors that are going on right now. Tell me a little bit. Can you tell me a little bit about September 11th and what as a therapist you saw and kind of worked with people and putting things back together then?
Yeah, sure. I think one of the really tricky things with 9/11, it was the fact is not everyone had the same experience. And that's exactly what's mimicking now. So the fact is that if you were at work and witnessed the towers going down, or you were at ground zero and you were someone that walked home and survived, or you were waiting for a call to see if your husband or wife or partner or child was going to be returning home. Or if you were sleeping and you just watched the news just like anyone else in America, after the fact, everyone had a different experience. And so that's exactly what's happening now. Not everyone is going through the same things at the same time with the same experience. We've seen some young people go, well, this doesn't really affect me. And because it's an old person's disease, or old person's virus. But now that's sort of changing, and we're hearing more and more teenagers feeling much more anxious, much more fearful, much more overwhelmed.
Mm.
And I think that that's across the world too. What's going on in Italy and the amount of massive loss that people are experiencing there, or in New York City. We're all kind of having different experiences, and that's what makes it difficult.
Talk to me about, again, I'm thinking both in um, September 11th and in Italy, for example, about first responders, for
Mm-hmm.
example, who themselves, um, you know, witnessed people dying or were kind of up front, up close and personal with that traumatic aspect of it. For that experience, how do they process it? How does somebody who's that intimately involved in kind of watching the tragedy from this deal with it?
The hard part with first responders is that we're all wired to sort of rush towards the emergency, the crisis, to want to help. And with that comes that we're not doing enough, right? How do I do more? We're seeing more and more people wanting to volunteer at this point at the hospitals, people donating their time, their expertise, which is amazing. And that community feeling and feeling part of actually supporting something to make a difference is so important for the people that are on the front line. But with that comes burnout.
Mm-hmm.
And so, what we really need to make sure is that we're preserving and protecting our first responders, our doctors, our medical communities, let alone the cleaning staff and the food services and the assistants at the front, or the receptionists or the security guards, or all the people that are sort of involved in order to keep a hospital, the administration, to keep a hospital afloat, to keep it going, the EMTs, the first responders, the firefighters, the police, the leader. I mean, there's so many people involved in how and supporting these type of causes, and to try to combat the health issue that we're currently experiencing, just like 9/11. And the big concern is burnout. So how are we sort of protecting that? What does that look like? How can the community help support, to continue to allow people to be able to do their jobs efficiently, effectively, to their best abilities, in order to support their communities is the big question.
What are some of the things that you've heard of that you really like about how people are as responding to this effort in terms of things people can do?
Yeah, and I think that you're bringing it back to 9/11 of what people did so well there, and then hopefully maybe kind of taking that as an example, and leading from example was really about thanking the community, EMTs and doctors and firefighters and police. Even hearing the gratitude that people are expressing goes a long way. It really builds the morale. It allows them to keep going when they're working these crazy shifts and having to be, as you know, be on all the time. So hearing
Mm-hmm.
that gratitude is so important. The other thing is food. So at 9/11, we saw a lot of people dropping off dinners or lunches to the police, to the fire stations. Clearly, we can do that from a distance at this point, of finding out from, hospitals of what are they needing for supplies, what are they needing from their homes, what are they not able to do because they're on these crazy shift schedules in order to be supporting the communities. Are there things in your neighborhood that you can do for these families that that are on the front line?
Yeah,
Um,
that's really nice. It,
Yeah, and I think there's so many things that we can be doing that are small. We don't have to be doing these huge gestures, but that can actually make the community feel part of something, that they're not able to be a doctor and saving lives the same way, but they can actually have an impact in supporting that person. And that's how people heal, is through support, through community, through communication. And that's what we need to be doing really well right now.
I will say that a lot of people, especially in doing these videos, have reached out and said thank you and been very encouraging, and it helps. It does feel good, and it does make a difference, especially social media stuff, which sometimes can be very distracting or stress inducing. It's really nice to hear the positivity and the support from people.
Mm.
I think Bill Clinton donated sent a whole bunch of pizza to various ERs or hospitals in New York. Um, Thinking about as you're talking, I'm thinking, and I'm like, gosh, it would be nice if people just dropped off food in the ER. Like it's one less thing to worry about, you know.
Yes. Yeah.
So yeah, I like your question of little ways of, especially if you know somebody, how can you support them? I'm like half laughing where I'm like, you guys can drop food off at my house anytime, anytime, you know.
Yeah. But there's also I'm talking to medical professionals with families, and they have children at home. And so how are they supposed to be schooling their children and then still doing 20-hour day shifts? How are they doing those things? Is there ways that the community can support meals? Food is always a great way to kind of show love and appreciation. But are there other things that they're needing? Are there other ways of support?
Mhm.
I just had a conversation with a doctor here yesterday, and she wasn't even aware of some of the free services, things like meditation apps like Headspace has offering for the year for anyone with an MPI number to have a free meditation app, which is amazing. And she said it was really making a difference for her. It's not something she ever did before, but just having a moment of actually being able to start her day with intention, with quiet, to be able to center herself, and having these communities contribute it in that way. Starbucks, Sweet Green Juices, they're small things, but they make a big impact on someone's life. They feel that the care and the connection, but also just it's, as you said, one less thing that they actually have to worry about.
Yeah, yeah. That's that headspace thing is. It's nice to see that even at a big corporate level, people are kind of giving like that in ways that can make a difference for
Mhm.
sure. Um, you know, so I hear kind of your answer being kind of about community support and thinking about burnout of the individual. um, I'm one of the two guys in our group. We have about 1,000 providers that focuses on wellness and burnout, and we've been doing little videos for years on this. And we always talk about a lot of things. We talk about the environment that we're in, which is difficult to change, but important to focus on in terms of in a doctor's world, it's everything from um, the electronic medical record to how long the shifts are and all of that stuff, managing all of that stuff. But then we also look at it on the individual level and self-care, basically, as the provider, making sure that, especially heading into what may be weeks of more hours, more patients, more intensity, even more important to care for yourself in those times. Meaning, some of it is the basics: getting enough sleep, eating plenty of fruits and vegetables, staying well nourished, exercising, and then, you and I have talked a lot about maintaining social connections, and especially this, we call it provider wellness, trying to prevent burnout. It's even more important, not only because it's more stressful, but also because we have the potential to get sick from it.
Mhm.
So that's kind of part of how we look at it from a individual resilience standpoint, and that's being important. I'm curious for you, like mentally. So we've got community support. How can the individual healthcare worker, doctor or nurse, respiratory therapist, knowing we're going to head into this kind of thing, what kind of mental outlook do you think is important in this time?
It's such a great question. And I think as you started this conversation, sort of looking at 9/11 and looking at the amount of healthcare providers and first responders experiencing such high levels of PTSD. and chronic PTSD. We really have to be able to sort of take a page from that book now and be really proactive and actually set things up for success. So the fact that you're involved with this group, the fact that you're talking about wellness and burnout with your community of 1,000 providers, hopefully we can kind of learn how not to do things that we did before. And the one thing we talked about was community, but the other is as you know, people that are in the helping profession tend to be the worst at self-care. We are great at helping other people, but we're not always great at creating our own structure, our own boundaries, our own routine, because you want to do more, especially in a crisis. This is something that we don't know when there's an end to. We don't know how long it's going to last. We don't know what our work schedules are going to look. There's kind of an indefinite here. And people want to just do more and more because there is a need to do more and more. So with that, what are we setting up for success in order that you're not getting sick and then having the risk of exposure that we're seeing, unfortunately, doctors. There was an RN yesterday that I saw on the news, unfortunately passed away. But we don't want to get to the point that we're putting the people that are most at need in danger because we're not actually helping them set those structures and routines up in their lives in order to self-care for them to do their job the most effectively. And we saw that in 9/11. We saw major burnout. We saw major PTSD. We saw major problems with people and their relationships and their families post. And that's so important that we're not duplicating that. What we did with that is we started to make preventative measures like creating programming with EMTs that part of their training is actually getting trauma training in order to protect themselves, but also their patients. Because if you're overwhelmed or you're traumatized, just think about that vicarious traumatization with your patients as well. So if we can kind of put that little thought in the head of healthcare providers and first responders and faculty and the staff and administration at this point is, hey, if you're not even just doing this for yourself, just thinking about the impact that you have on your patients at this point and their communities.
What you mentioned trauma training.
Mm-hmm.
What kind of stuff is in there?
So really, it's really about, in some of the things that we've talked about, the importance of creating a structure and routine. What does your food look like in the morning? What's your sleep schedule look like? Which I know, as doctors is not always great. How are they connecting? What type of coping skills are they doing to sort of manage grief and loss? Is there ceremonies and rituals around the concept of loss? The hard part with this is that touch is not something that we can be doing, unfortunately.
Yeah.
And that is such a healing aspect of healing from trauma. So how are we finding new ways to do that? What are your outlets that you have? Maybe you are binge watching a Netflix show, that just allows you to escape for a minute. Maybe you're jump roping. Maybe you're making sure that you're cooking healthy meals. You're doing things that actually, for each individual, are really helping them to maintain their self-care, to allow them to sort of take reprieve and a moment away from the experience that they're in on a daily basis, in order to kind of allow their body just to be at rest, that they're not always in a hyper-vigilant, hyper-aroused state, exhausted, overwhelmed, and not being able to use the prefrontal cortex to be able to think and make good decisions. But we really, really, really have to be doing that more than ever right now.
It's easy, especially I'm thinking about paramedics and ER, doctors and nurses. It's easy to get hooked on the adrenaline, and heading into something like this, just to live in that adrenaline for too long and then just crash and burn.
Yeah.
And especially the risk of that crash and burn, with this virus going around, could mean that you end up on the bench for a couple weeks, if not worse. I think there's I know, I can imagine like a lot of people listening to this saying, oh, that sounds all good in theory, but somebody's got to do the shift. Somebody's got to run the ambulance. Like, we're not going to take excessive time off, put our feet up and get a massage. It's like, we're going to get in there and keep doing it. I know, like, for so many people, the reality of this thing for a fair amount of time, weeks or a couple months, is going to be pretty rough and pretty busy and pretty overwhelming. If you're in the mix of it and you can't take as much time off because of staffing shortages and things like that, what are other things that you can do aside from, we talked about having a routine, staying well slept, eating well. What are things you can do in the moment? You know, I don't know, deep breathing, like kind of
Sure.
trying to get the adrenaline out. I mean, moment to moment for those periods that may be long hours and rough and whatever. How can you in that moment, um, do better?
Yeah. While in a dream world, we're all getting 8 hours of sleep and we're eating amazing and we're staying rested and we're in our communities. I mean, that's all a dream scenario, which you and I both know that's not happening and that won't be happening. But what we can do is that we can be mindful of actually how we're taking care of ourselves, even in what you're talking about those moments. So whether it's headspace or you have a jump rope in the back that you're just doing 5 minutes just to get your heart rates going. Pinky breathing. I don't know if you know this, but when we put our two pinkies together,
I've never heard of
and
this. What is it?
so when we put our two pinkies together, it forces an abdomen breath. So if you breathe in and you breathe out, when people are talking about meditation or they're talking about yoga and they're talking about breathing from an abdomen breath, this forces every single person on the entire planet. It forces us to engage with our belly breathing, which actually helps to lower our nervous system. The cool thing is if you actually put your two thumbs together, see where you breathe. Breathe in and breathe out. And as your fingers going down, you'll see that it activates different parts of your breathing. But this is a shallow breath. This is a hyper aroused breath when we're doing it with our thumbs, that we're activating the top part of our breath, which is what actually causes panic, which causes anxiety. But when we breathe with our pinkies,
Don't do the thumb breathing.
yeah, do the pinky breathing. Um, and
I've never heard that before. Pinky breathing. I'll have to try that.
Yeah. And so that can be something that you're literally putting your two pinkies together. You're breathing in for 6, you're holding it for 7, and you're breathing out for 8. And I actually even like to say, let's make a noisy breath, because what that does is it just sort of allows us to release everything, all that tension and stress in that moment. If you have 3 minutes and you're literally putting your two pinkies together and you're doing a breath of 6, 7, and 8, and you're in the ER and you're taking a moment to recenter yourself, to ground yourself, to put yourself back in that room, you're going to be able to be much more effective when you're going into that next patient or making another decision, because you're not just on this adrenaline high. Your body has to rest. So that's something so small that we all can do. It's actually a little sports trick that a lot of top athletes use in order to center themselves. Yeah. So we can do that by just grounding ourselves and being aware of our body, being aware of what's happening, putting us back into the room, making us more present in order to be able to kind of get to that next part of decision making that we have to do with so much stress around us.
I like that. It makes me think of, you talked about routines. If we've got an 8-hour shift in the ER, you can kind of go at it for a while and then schedule, at least in your mind, have periodic breaks. At 3 hours, take a break, eat something. At another 3 hours, take a break, eat something, and you've got 2 hours left and can kind of finish it off. Sometimes just going out, if you can go outside for a minute, just get a breath of fresh air, just a couple minutes, 5 minutes. A lot of people, unfortunately, do this and take smoke breaks, but I think it's part of it is just the change of scenery and getting out and doing deep breathing. Unfortunately, they're, inhaling smoked tobacco, but the the rhythm and the schedule of taking a break and getting out of there. We have a call room in one of the hospitals that I work at, and I am, as you're talking about this, I'm thinking, I'm like, I need to make sure that I'm conscious, and that obviously you can't do it in the middle of an emergency, but Usually within an 8 hour period, there are times when you can step into that room for just a matter of minutes and do some breathing and stretching. You're not going to get a half-hour workout in, but just enough to kind of shake it off, get out of your body, and then kind of recharge, get the adrenaline out of you for a minute, kind of recharge, and then return in a better, more refreshed state. And so things like that of how can you manage your shift with regular little breaks, little recharges to get through it so that it's not adrenaline to the max for 8, 10, or 12 hours and then done. I think that stuff makes a difference.
And even when we're talking about exercise or nutrition with that, I mean, if we're asking the communities to really support, drop off fresh fruit, drop off things that are healthy, drop off juices. Don't drop off cookies and cakes and things that are actually just going to allow your blood sugar levels to spike and then you're dropping down. That's not helping anyone, even though it's out of kindness and everyone likes a chocolate chip cookie. But the community has to really be thinking about how they're actually serving and being useful to people that are working these type of shifts. And then also from exercise, I love a jump rope. We've got this 10 push-up challenge that's going on around the internet, doing 10 push-ups, doing a couple sit-ups, doing a few minutes with a jump rope, even if that's in the call room, that there's a little bit of space for you guys just to get some blood flow going in your body. Again, that can just really get you out of your head for a moment and kind of feel like you're breathing really deeply in order to be able to transition, to be able to process things better. And to your point again, rather than going outside and smoking, can we go out and can we breathe? Can we just notice and be present of nature around us? Can we have a moment of connection with another human being? Can we actually just give ourselves a second to be able to rest in our bodies before we go back to the adrenaline-filled job that we have?
Mm-hmm. I also like those bands, those exercise bands where you can, those are easy to take with you and kind of do little basic things to kind of get the blood flowing.
Yeah. And can we ask our communities to drop those things off to our hospitals, just so that they're there? This isn't even a situation that would be useful for just now, but going forward for your community when you're thinking about wellness for your staff and for the practitioners that you work with.
Let me ask you a different question. And this is, I'm just going to go right at it. But for those of us who are taking care of patients that are critically ill and we lose them and they die and our patients die, how can we deal with that in the most healthy way? What are some of the traps or pitfalls in doing it when somebody goes, I'm thinking about guilt, feeling like we should have done more, and giving at the same time some space to kind of grieve that, because we just have to keep going. Sometimes you don't even have a moment to process that as a human being. You have to keep, a lot of the ERs I work in, there's only one doctor. So if I lose somebody, I can't take an hour or a day off, or it's really difficult to process that and go on. What advice do you have for those of us in the field when we lose people, when we lose our patients?
Well, really and again, I'm just going to keep, because we started talking about 9/11, what we learned and what we learned how to do better was the importance of partnership within your staff, within your community that's there and witnessing the same thing. So for instance, with first responders is really encouraging them to be checking in with their partners when things are going on. How are you doing? How are you managing this? How are you feeling? How are you processing? Because we need that human connection in order to sort of process this as a past occurrence. It's not continuing staying in our body, that we're not getting traumatized from it, that we have our own grief and ritual and ceremony around the loss of someone that we had contact with in our lives and we tried to save is so important. So what I think that often happens is that we try to go it alone and go, okay, we're tough and we just have to keep going and there's nothing I can do about it and I'll worry about that later.
Yeah.
Well, the worrying about it later is what actually gets us in trouble. So having support groups, We saw that Cuomo has asked mental health practitioners who can volunteer to come into the hospitals now more than ever because they're needing more mental health wellness practitioners in order to really be helping the staff.
Yeah.
Even if it's for 10 minutes and just doing a check-in and going, how are you doing? What's going on with you? What's going on in your body? Because our bodies talk to us, and especially when we've been through trauma. So we have to really be paying attention to that and allowing our doctors and our clinicians to really be able to grieve the loss of something that they had no control over in the end, which is really hard for doctors to not feel like they have control. So I keep talking about the same thing, but connection, community, support, communicating your feelings, getting support from mental health practitioners, reaching out, telling people how you're doing. And then also the people around them need to really be checking in, and not just checking in once and then going on with their day, but regularly checking in with them for a while, because oftentimes what can happen is that the trauma happens, they're okay, and then a couple weeks or a couple months later on, something shifts. And that's when they get into trouble, and that's when they really start experiencing chronic stress or traumatic stress, or they have some sort of traumatic incident from they're having some sort of symptoms from the traumatic incident that they experienced.
Talk to me a little bit about, you said you mentioned for a second how your body is giving you signals and your body is kind of talking to you. What are common ways that people's body communicate to them? What do they feel? What does it mean?
When they've been traumatized by something.
Yeah, in the context of
Of loss.
this, yeah.
So really, forgetfulness. People will find that, oh, I misplaced my phone. I can't find something. I didn't remember. So having memory loss, having time loss, having chronic pain. Well, we saw a lot with the EMTs and first responders that they all developed like carpal tunnel or some joint issues or all different types of things later on. Heart issues for sure. Those are a big thing that we really have to be protective of with trauma, is that chronic stress and the adrenaline that you're putting your heart under during those circumstances, compounded with loss or grief and trauma, can put a tremendous amount of stress on our hearts. And sort of panic attacks, high anxiety. And with high anxiety, oftentimes comes depression. So people don't always get support when they're experiencing anxiety, but they will get support when they're experiencing depression because they're not able to get out of bed, or they're not functioning, or their immune systems get kicked, and they end up getting sick as a result of it, because all of those things happen with it. So people become aggressive. We're hearing high conflict at home, or because they're not able to regulate their emotions. They get very flooded and they're not able to think of being able to calm themselves down. So they become very reactive. We see that with military personnel coming home from war situations, unfortunately. And then, of course, substance abuse issues of trying to escape and numb by using substance. You're talking about smoking, but clearly, there's lots of things people are using. And that's why I think now that you're seeing the AA groups really stepping up and having a lot of virtual support groups out there.
Online
We're seeing
stuff.
a lot of prayer. We're seeing a lot of churches really coming together in order to support as much as possible, to give people easy ways to support them so that they're not ending up with those kind of symptoms later on.
Yeah. Wow. So the process, it sounds like, is one, I'm thinking about the individual person of checking in with yourself, seeing like, how do you feel? How does your body feel? Kind of going from head to toe, feeling all of this stuff, asking like, am I in one of these amped up adrenaline states? Am I like that a lot of the time? How can I let that out? How can I relax? How can I breathe through it? Exercise, whatever the way is. And then as you feel individual symptoms, whether it's anxieties or pains, or you feel it up here or in your joints or whatever, it sounds like you just kind of have to explore, you know, and get curious. What is this about for me? Where is this coming from? Is there a connection with what's going on?
I think that yes, I think it's you doing that, but with healthcare professionals who are overstressed and don't have a lot of time, it's up also to the communities to check in with them. It's with their families, it's with their coworkers, it's with their staff. Um, excuse me. Really making sure to see how they're doing, and that needs to be really important.
This has been good. We've covered a lot. Does anything else come to your mind around this topic of heading into this and this time and all of our first responders? Talk to me a little bit more about the home life and family life, especially for families of people that are working hard in the front lines, and how that they might be affected in this time.
Yeah, that is such an important question, and also for people to really realize it. So their home lives have to be very sanitized, because it's not at risk of them infecting their families, but as much as which it is, but it's also the risk of infecting them, which then they're bringing into their hospitals, to their ambulances, to their fire stations, and possibly actually having an entire community that is so needed to be getting sick.
Mm-hmm.
So their home lives are being scrubbed, their packages are being scrubbed, their families are having to be very, very vigilant on cleanliness and Clorox wipes and everything in between. And also also a lot of first responders and medical personnel are isolated from their families in order to protect for the same reason, which is really tough to have that kind of isolation.
Yeah, that's hard.
To not be able to hug your children or to be sleeping in the same bed with your partner, that is very, very challenging. So that's compounding the situation. Unlike other times that we've lived in crisis, that they can't get that contact and the support that they need from their families, and in fear of actually infecting other people, is super challenging for them.
Yeah, definitely.
And then also too, for their children and their families too, of feeling like they're not able to process what's going on with their parent because their parent needs to be in isolation.
Yeah, and it's harder for them to kind of be there emotionally and be present for their family, which has their own set of needs, from this person that may be on the front line.
Mm-hmm. So again, that's really where we have to kind of come together, and every single person can do something. Don't think that what you're doing is too small. You can send gift cards. UCLA has actually it's uclahealth.org/giving/COVID-19 philanthropic support. You can give to those type of giving ways that you can do a $25 gift card. You can buy flowers. You can send over, to have like a bouquet of flowers in the hospital would be amazing. Also helping the communities where they really depend on these services right now. How are we kind of coming together in order to sort of help everyone, small businesses, helping the medical personnel? Are there things that you can be donating? Are there things that are needed? Reach out, find out how you can help, because we are all in this together, and we have to be working together in order to get through this as strong, and also to have that post-traumatic growth of what's the meaning making, and what's sort of the beauty and the development that comes out of all of this grief and loss at this point. There has to be that process.
Tell me a little bit more about that meaning making.
Well, there's a saying in trauma is called post-traumatic growth. And what it is really from a trauma of how we're finding meaning making from that experience. We don't know what that's going to look like now. We know that our communities were really disconnected. we were kind of all on social media, and until this time now we're sort of having to kind of figure out how to be united and come together as communities and how to support one another. And and there may be something really beautiful that comes out of this. It might be for an individual, it might be for a community, it might be for a nation, it might be for a world. And so we're in the loss and the fear, and we're in this kind of process now. But I think that all of us can be reflective in this time, in this moment, and call to ourselves of what can we be doing to make an impact? How can we create change? What can we do to be supporting someone else? What's the meaning making of all of this for ourselves, for our community, for our families, for our nation, for our world? And that's what sometimes out of horrible situations and out of trauma, out of loss comes these beautiful meaning making, these beautiful stories, these beautiful evolution of things. And we'll have to see what that looks like for all of us after we're beyond that and we've survived and we're thriving. What does that look like?
It's crazy. It almost feels a little wrong to think, but I think you're right. After we're not there yet, we're still in the middle of this thing. But what good can come of this?
Mm-hmm.
The post-traumatic growth. I do appreciate a lot of the opportunities, in so many ways that that as we're going through this for things to get better and for things to evolve, both for all of us as individuals and then just societal things, from healthcare and education to business and all of it. It's good to be hopeful and to always try to balance that truth telling and being realistic and honest about what's happening with not being, fear-inducing or doomsday or the world's ending, and remembering this, this thing will come to an end. There will be good things that come of it, and one day at a time, let's do our best and get through it.
For sure, we have to have hope. We have to have kindness. We have to have connection. We have to be supportive of one another, and we will be different from this time. But we can actually work towards that being something positive. And I think that's what we all have to be conscious of. If we allow ourselves just to stay in the negative and stay in the fear and stay in the overwhelmed, none of us are functioning. We're not helping one another. We're not growing. We're not developing. We actually have to figure out how we're going to get through this and thrive. And that's the growth from a trauma.
Yeah, so true. This has been good. Did we miss anything? Are there other things that you want to touch on in this conversation?
No, I think we covered a lot, Larry. I really appreciate it. And just reiterating, support your communities, show gratitude, be aware of what other people need. Don't be afraid to ask, what they may need. No act of kindness is too small. You can have an impact. And to really just be thinking about how we can be in this together, making a difference is so, so important at this time.
Suzy, thanks for taking the time to share your knowledge and expertise. I know that this will reach I hope it reaches a lot of everybody, but specifically healthcare providers and their families and communities to help us, get through this time the best we can.
Thanks, Larry.
So you guys can check this out. We will post this on social media. This will live on the Daily Corona Q&A with the Dr. Larry Burchett podcast. We'll provide that link. Thanks for tuning in, and we will see you next time. Suzy, is there a place people can follow you?
Sure. It's Susan Zinn, Zinn Therapy, on Instagram, and then also on my website, which is SusanZinnTherapy.com.
Thanks, Suzy.
Thank you.
All right, guys,
Bye.
We'll see you next time.